board. All right, so good afternoon, everyone. Thank you for joining us today for Connection Isn't Complicated, Youth Perspective of Mental Health Issues in Maine. I'm Heather Drake, the Membership and Engagement Director with the Maine Public Health Association. Today's event is part of our Health Equity webinar series, Health Equity from Information to Action, which has been developed by our Health Equity member section. So I want to thank our member section for their work organizing today's event, members of the Maine Youth Action Network's Youth Health Council for presenting today, and all of you for being here to learn about this important topic. So before we begin, just a couple logistics. Today's webinar, as you were probably alerted, and I already mentioned, is being recorded. We'll send it out to all the registrants and we'll post it on our website as well, either later today or tomorrow. And you can find other upcoming webinars in the Health Equity series, along with recordings from prior Health Equity events and all of our events in general on our website. And I'll put that link in the chat in a minute. Please stay muted unless we ask you to come off mute and participate, just to minimize any background noise. We will be doing probably some breakout rooms towards the end. So we ask you to actively participate in those too, and we'll take questions then as well. So I think that's it. So with that, I am happy to welcome Gabe O'Brien with the Maine Youth Action Network, and he'll get us started this afternoon. So thanks for being here, Gabe. Turn it over to you.
Yeah. Thank you so much, Heather. Thank you so much, everybody, for participating and showing up today. We are so excited. Before I introduce our youth council members who are going to be doing the bulk of the talking, I wanted to provide just a little bit of context of how we arrived here. So the Youth Health Council was formed as an idea last summer after a year ago we ran a survey. And while young people were involved in the creation of that survey, it wasn't until we got the results that we wanted to form a board and a group of young people to evaluate and tell us what that meant to them, and then continue that research. So we had a youth participatory action research model that we then recruited some young folks from across the state, two of which are here today. And they're going to be talking about some of the work that they've done over the past 9 months together, as well as the recommendations that came out of our conversations. And we're going to kick it off in the way we kick off every Youth Health Council meeting, which is by inviting folks to show up as they are with their name, pronouns, which you can drop in the chat along with us as we introduce ourselves. So Isla, I'm going to come to you first and invite you to share your name, your pronouns, where you're calling in from, and then what was our check-in question? Oh, if you were a flavor ice cream, what flavor would you be and why? And Lauren's going to drop that prompt in chat. So if other folks who are in the call want to join us, feel free to type out your answers. We'd love to see who's with us today.
All right. Yeah. So my name is Isla. I use the pronoun she, her, and I am located in Yarmouth, Maine. And if I were to be an ice cream flavor, it's a hard one. I would have to say strawberry, just because I love the color pink. I love fruit. And I can only hope that some of that's reflected in my personality. But yes, I would go with strawberry. Awesome. And you want me to tag someone?
Yeah, why don't we toss it over to Lily?
Okay, yeah, Lily, you go.
Hi, I'm Lily. I use she, they pronouns, and I'm located in Buxton. If I was an ice cream flavor, I think I would be, it's not really ice cream, but lemon sorbet. Just because I love spring and summer, two favorite seasons. Yeah. Should I pass it to somebody, Gabe, or?
Let's go over to Lauren. Lauren, who co-facilitator of the Youth Health Council, would love to hear you introduce yourself today, Lauren.
Hi, everyone. I was in the middle of typing it, but thanks for, I was struggling with the words. I'm Lauren. My pronouns are she, hers. I am calling in from Saco today, and the ice cream flavor that I would be, I'm forgetting what it's called, but it's that like party flavor with the cake chunks and the icing in it, because I just love celebrating.
I love that. I love that. So hi folks, my name's Gabe. I use he, him, his pronouns. I'm originally from Winter Harbor, Maine. Today I'm calling in from the Portland area. And if I was a flavor of ice cream, I struggle with this question because it changes all the time. But I think today I'm a really good coffee espresso chip, specifically from Gorgeous Gelato. If you haven't had the chance to get it yet, It's espresso chip is the technical name, but I'm feeling a little energetic if you haven't picked that up, and you got to have that nice crunch because there's a little bit of a crunch to it too. Thank you so much. So the Youth Health Council, we're going to talk a little bit more about it, and more importantly, the young folks are going to talk about the Youth Health Council. And I'm loving some of these answers. I see some Ben and Jerry's flavors as well as pistachio. Loving those answers. Keep dropping them in there. We'd love to see who's joining us today. But to orient us to the work of the Youth Health Council, I'm going to invite Isla and Lily to talk a little bit about why they joined and what they got out of the experience of the Youth Health Council, to articulate a little bit more about what this group's about. We're going to start with Lily, if that's okay, and then we'll come to Isla.
Yeah, definitely. Well, I joined the Youth Health Council because I am interested in public health. That's something I want to get a degree in and hopefully do as a job one day. And I really think that being in the council like helped me build the skills I'll need for that in the future. And like I really was able to connect with other members who had the same like dreams of the future as I do, and yeah, just built a really great group of people.
Yeah, I love that, Lily. One thing that stood out to me too is just your desire to talk about access and stigma, which has become a central thread through our entire group. Isla, how about you? What brought you to the council, and what have you gotten out of the experience?
Well, for me, it was first presented to me. So when it was first presented to me, it was an opportunity to research about health topics, which for me, I was still in high school, and I am starting college next year. I'm interested in health and general like health professions as a whole. I'm not quite sure what I want to do yet, but when I was given the opportunity to potentially do research in that field, I was super excited. So I did not hesitate to join, and it's been really great ever since. And then what I've gotten out of it, not only have we done research in different areas of health, I have really enjoyed getting to work with Mainers from all over and people that I might not necessarily interact with. I live in Southern Maine and my school is quite small, so meeting new Zoom faces and talking about things that I'm passionate about was something that I was very happy to get out of the experience.
Awesome. Thank you both. Before we come and start our first activity, which is going to be quite exciting, I want to name there's a couple other members who weren't able to be here today. We'll have Avery joining us via pre-recorded video later in the presentation. We have Mackenzie from Machias and Serenity from up in Milo. Unfortunately, due to other commitments, weren't able to be here, and we've had some changes in membership over the time. But I wanted to articulate that research point, which I think Isla is doing a great job, just to give you a little bit of timeline of our work together. So as I mentioned, we started with the What About Me Youth Health Survey, and then August and September, we did recruiting. And then along the bottom, you can see the stages of youth participatory action research, which involves training, which for us was a lot of discussion, activities, additional research, building up the skills and knowledge we needed to be able to evaluate the research. And then both Isla and Lily are incredible researchers already, and we coded and evaluated both a quantitative and qualitative research survey rather. Lily did all of the qualitative measurements, which was incredibly impressive. And then you can see in May and June, we were starting our implementation, development of recommendations, which you're going to hear today. But that's enough of that. We will also be sharing this out next week, hopefully, so you can refer back to it. But this is a little bit of our timeline. So with that, I'm going to turn it over to Lily and Isla to get us going on our wonderful first activity. And I will share. Do you want me to share the slideshow? Cool.
Yeah.
So for the first activity that we're going to be doing, we really felt that as like a group, one of the main ways that we were able to connect to each other was using games. And it kind of brought us around to the point that our main point today, which is connection doesn't have to be complicated. It can actually be fun. So has anybody here played Guespionage? No? Okay. Well, it is a statistics game about, so basically we will present you with a kind of description of the statistic that you'll be guessing, and we will call on a random participant to kind of guesstimate what about, like, from 1 to 100, what percent the statistic is. And everybody else can either after that say, oh, it's going to be higher than what the original guesser guessed, or lower. And based on whether you were right or wrong, you get points. I think we'll be naming like some random points after each question, just, you know, just for fun. We won't be we won't be like writing down how many points each person gets, but you can keep track of your own score if you want to. So without further ado, Isla, if you want to take the first question.
Sure. All right. What percentage of adults over the age of 65 use Snapchat? And if I can view the gallery, we'll pick on a person, and you do not have to be right. And then again, if you win, you get bragging rights. So don't worry about being wrong. All right. Let me have the Jeopardy theme song. Let's pick on Courtney L. What is your guess?
Probably like what, 10%, 5%?
Good guess.
5% your final answer?
We're going with 5.
Oh, 5. Okay. All right. Now all right, what do we want to do now?
Do we want to invite folks to say higher or lower?
Yeah.
Higher or you can drop it in the chat, or you can do the raise hand signal for if you think it's higher, and do the clapping signal if you think it is lower.
All right, I'm seeing a mix of guesses over here in the chat. Tell me when to reveal the truth. Tell me to reveal the truth.
Let's give like seconds. All right, Gabe, it's time.
All right, the moment of truth. Drum roll, please. Here we go.
You were very close, Courtney.
How many points is that?
Oh, let's say 500.
Woohoo!
Awesome. On to the next one.
All right, Lily, do you want to take this one?
Yes, I will. So for this question, prior to the COVID-19 pandemic, what percentage of Maine children had a mental health condition? And I am going to pick on, let's go with Kelsey Lowell. What do you think?
Oh God, I'm gonna say Maine children under 18. I'm gonna say 38%.
Good guess, good guess. Now if everybody could do the same thing and chime in with higher or lower.
Higher's definitely pulling the lead here. All right, I see the raised hand is coming in for a higher. All right, we got some lowers. We got some voters for the lower. Tell me when you want the moment of truth.
Everybody's had a chance to answer. I think we can go ahead and reveal it for, let's go with 1,000 points on this one. 25%. So you were very close, about 13% off on that.
Alrighty. Next up, what percentage of Americans believe in ghosts? I think specifically adult Americans.
Who's answering this one?
How about Mary Karen?
Oh, um, I have absolutely no idea, but I'm just gonna go with a solid round 50%.
All right, let's see the higher or lower in the chat.
All right, 750 points for this one.
How do you all arrive to your points?
Very randomly.
Very, I love it. I love it. On the money. Lower, we got a lot of lowers.
Yeah.
All right, tell me when to reveal.
All right. It's time.
Oh, man.
That was a good guess.
It felt like 50-50.
Okay, for the next questions, what percent of Maine teens with depression did not receive care in the past year? I will go with person I'm gonna pick on now. Let's go with Zubaida.
I'm gonna be pessimistic and say like 55.
Good guess, good guess. Now, if anybody can chime in with their thinking it's higher or lower, and I think we're gonna go for 1,500 on this one.
All right, we're seeing a lot of hires. Some hires in all caps. All right, ready to reveal?
I think we are. You were very, very close to Zubaida. Wow, good job.
Yeah, unfortunately,
Excellent guessing skills.
yeah, pessimism is not necessarily wrong in this case. All right, I think we got a couple more. Oh, I like this one.
What percentage of adults sleep with a comfort object, such as a teddy bear? And I will find someone to pick on. Let's pick Beth Broderick.
22%.
22.
All right.
How much is this worth? I know Beth is very competitive, so I know she's keeping track of point.
Do 1,500.
All right. Does that include live animals, Isla?
Oh, that's a good question. Well, then I think we'd have to give her a chance to re-guess. So let's say no.
Okay, so does not include.
Does not include live animals.
All right.
Even though they are objects.
They definitely are comfort. All right, here we go with the answer.
Not too far. Nice, nice.
Well done, well done. All right. Oh, this one we've already had. I think we got one more. Do you want to just jump to the last one? I'm going to skip this one.
Yeah, let's do that.
All right.
Okay, what percentage of high school students experience poor mental health during the pandemic? And let's go with Crystal.
76%.
All right, higher or lower, friends?
Youth voices and connecting. And
all right.
I'm seeing a lot of hires. Okay, yeah. I think we're about ready to reveal.
Let's go.
Over a third. So this was, you were a little bit off, but not a bad guess. Not a bad guess.
You can chalk it up to underreporting.
Yes, it could have been what was reported from like doctors or something like that, I'm sure. Right, so our agenda.
All right, yes, I can take this one. So we just wanted to come together and formulate our plan for what we hope to discuss today. We already did our introductions. And then we are going to talk about what is the issue that we're chatting about today, and then the why behind it. And then we also want to acknowledge the effects of these issues. And then finally, our recommendations for how we can help change this issue. So I wanted to give you a brief image of what we had hoped to discuss today.
So I will be doing our what is the issue section. Okay, so what is the issue? This is Bill. This is going to be a bit of a little storyline for you guys. Bill is a teen in Maine who has recently been experiencing moderate issues with his mental health. Some days are harder for Bill than others, but he's not at risk for hurting himself. Bill's friend Joe is another teen in Maine, but he isn't experiencing mental health issues like Bill is. Joe likes to play baseball because he thinks it's fun and it keeps him mentally healthy and motivated. Sometimes Bill doesn't want to play baseball with Joe. He knows that baseball is fun and healthy, but because he's experiencing symptoms of mental illness, he just doesn't feel like he can do it. Bill knows that because of his mental illness, it is harder for him to engage in activities and habits that benefit his mental wellness. While Joe can utilize baseball as a mental health resource on his own, Bill has a harder time helping himself with his mental health than Joe does. Since it's often difficult for Bill to engage in activities or form healthy habits that can improve his mental wellness on his own, he decides to seek professional treatment for his symptoms. However, many mental health professionals in his area are busy treating patients like Sally, who are experiencing a mental health crisis. Bill knows that Sally needs help more urgently than he does, but why does he have to wait until he's in crisis to get professional support? And this bill kind of represents the thousands of Maine youth experiencing mental health problems they're unable to support their mental wellness themselves and try to seek support from professionals like therapists, like pediatricians, all of that stuff. But waiting lists are long right now, especially after the pandemic. And it is largely inaccessible for many of these teens to get the treatment that they need. Unless they are at a crisis point, like Sally is. Even in a typical high school health class, students are taught both how to care for their mental health and how to help themselves or peer in crisis. But what about the youth who fall in between these two extremes? Here's what we know about mental health and this gap with teen mental health in Maine. 42.9% of Maine teens experiencing depression did not receive professional care in the past year. And this is often because of the lack of resources that they have. And when allocating these resources to youth who urgently need it, who are in a crisis, the focus often is pulled away from teens who are headed in that direction, and they cannot get help before they reach a crisis point. Mental health care in Maine is inaccessible for a variety of reasons, especially for youth living in rural areas or in poverty. In the small survey that we did for our council, we found a lot of responses saying that like a big factor for their mental health and why youth cannot access the resources that they need to be healthy is because of rurality, or because they live so far away from a provider that is available that they are unable to get those resources. And we also know that the common methods of mental health education do not benefit those in the gap between mental health and mental crisis. Often, I know my experience in a high school health class is that we have a unit on mental wellness and how to maintain that. And we also have a unit on how to help yourself or a friend in crisis. And that's typically to talk to an adult. But often the people who are in between those two spaces don't feel as though they benefit from either one of those resources. They cannot help their mental health on their own, like they're taught in health class, but they also do not need crisis help or crisis prevention. So the gap between which youth the current mental health care system is reaching and the youth who also need support is the issue we're facing. So our big issue, how do we help kids like that?
Awesome. So I'm going to stop sharing just for a moment because Avery is going to video in to talk about this issue a little bit further. Let me just pull up that video and make it so she's not just talking to me. All right. Wait, I forgot to share my sound too. Apologies for the tech support disaster. Now we're sharing sound. Now we're cooking with gasoline. And I'm going to turn up my sound so you all can hear it.
Okay, so why is this an issue? The current lack of youth mental health services in our state has led to a number of mental health issues, and it's also led to a number of related issues. We've seen a lack of psychiatrists in the past year. We've seen really long waiting lists for kids to be able to get help for their mental health and feel supported. We've seen communities shut down where students would otherwise go to get support. We've seen students in our survey say they go to fire stations to get support. They go to teachers, they go to friends, but the big answer was really they go to communities. And some places are really lacking that strong sense of community that helps so many students feel comfortable and accepted. The current state of youth mental health in Maine is also becoming clear through the results of the 2019 Maine Integrated Youth Health Survey, specifically those results regarding suicide and support people. So 32.1% of survey takers answered yes to having an overwhelming feeling of hopelessness, but only 3.7% of those felt comfortable seeking support from school staff, and 25.4% would seek support from a family member. Although the 25.4% may seem like a high number, this does leave a substantial gap in students who are needing support and students who are getting support. These numbers told us that there is a big number of students who are not getting support, and they very much need and deserve this help. And this is why we are urging the need for change.
Awesome. Thanks, Avery. I hope she heard me. So we're going to take a break from screen sharing and shift into a more interactive opportunity to talk about mental health. So this section is what are the effects of it? And to do this, Lily and Isla, I'm going to need your help setting up for the root causes activity that we've done before. So to do this, I'm going to draw on a screen. Can you walk folks through what I'm doing and what they're going to be asked to do in just a moment?
Yeah, definitely. So our root causes activity we did in a group with the Health Council before. And it's basically, we have a drawing of a tree, and the trunk of the tree kind of represents the main issue, which is mental health access for youth, and just like mental health issues for youth in general. The roots of the tree are the root problems of this issue and like what brings about mental health issues in young people, and like all these like causes in like their communities and like families and like any other external factors that can affect mental health for young people. The leaves are kind of like the effects of what happens when you have poor mental health in a population, and this activity is young people again. So it's kind of like anything that you can think of that's like could affect an individual's lives or could affect effects seen in like their communities as a whole. So what we're going to try to do today is me and Isla are going to start off with some examples that we have experienced or that we have seen in our communities, and then we're going to ask you all to kind of chime in, either like raise your hand and then we can like ask you what you were thinking, and or you can drop it in the chat and Gabe will put all of our answers up on the tree where they are kind of placed. But for a twist on this, we're going to ask you to answer these questions with the perspective of a young person in your life. So could be a younger sibling or a student that you know, or any other young person in your life, and like what they would kind of experience for the effects and the root causes of this issue. So
awesome.
Yeah.
So yes, so just to reiterate, I'm going to try and capture. Thank you so much, Lily. I'm also super proud of my tree. I hope everybody else is as well. This did not go as well when we did it last time. But what are some impacts, Lily? You mentioned that these leaves that we're going to be drawing are the impacts of mental health challenges for young people. What are some of those for you and Isla that show up?
So definitely a big one that comes to mind for my community and communities as a whole is substance abuse in teens is a really harmful thing that comes out of poor mental health and teens attempting to self-medicate. Isla, if you would like to share one.
Sure. Yeah, for me, I would put withdrawing from meaningful friendships. I've seen it in some of my peers when things start to get hard and they don't feel they have the support that they need. They become very distant, which puts stress on them, but can also harm the community that they are in as well.
Yeah, thank you both for sharing. It's a strong tree. Thanks, Riley. So if you want to drop some tree knowledge in here as well with some leaves, if folks want to drop those in chats, what are the impacts of mental health challenges for young people, as you might answer? Unstable housing. Yeah, thank you. And Lily and Isla, feel free to come off mute, read some of those in chat, and or add just some of your own.
The next one is self-harm.
Yeah.
Disengagement from school was one that I saw.
Depression, unemployment, and then withdrawal too.
Lots of great responses right now. Wow.
You can't keep up. Body pressure from social media.
Gender identity confusion.
Poor school performance. Let us know if we're going too quick. I don't want to overwhelm you.
No, you're doing great. I'm doing my darndest to catch all these. So if I miss one, just let me know.
Another withdrawing from activities. Unhealthy eating habits or overeating or undereating.
Feelings of isolation and lack of socialization.
More time online, for example, gaming.
Poor physical health in general.
Yeah. What do you two think is missing from this list so far?
Oh, I saw somebody add violence.
Yeah.
Violence. Also miss poor physical health. Yeah.
I'd say,
oh, go ahead.
Sorry, I'd say a big one that I see missing from this is kind of a sense of like general apathy, or like generally feeling like the world as a whole is kind of like not great. Like I know a big thing with that is also like with climate change, people are feeling kind of like I think it's the word is like nihilism.
You're really stretching my spelling. How do you spell nihilism? All right, good. Someone.
I think it's NIHILISM.
It's a lot of I's, but we're rolling with it. Apathy and nihilism. How about you, Isla? Something missing from this list for you?
Well, I was just gonna add I maybe might go with the meaningful relationships piece, but strained families, and like changes in dynamics. And then there's a couple more in the chat that I think would be beneficial as well. A sense of not belonging, low energy, feelings of defeat. So just kind of an overwhelming fear, like feeling of hopelessness and negativity. And yeah.
All right, let's transition to these roots. So what do you all see as some of the root causes for mental health challenges as young people? What feeds into this tree?
A big one that I see is instability in either like families, financial situations.
Yeah. What else?
Inadequate support in schools. And then someone put stigma in the chat too, which was my next.
Yeah, stigma, which was a big source of our conversation. Stigma. What else? What else are these root causes?
A good couple that I saw in the chat was over responsibility and pressure to perform.
Yeah.
And then also lack of mental health education or prevention. So supportive relationships and education as a whole too.
Early trauma is a good one.
Family history too, whether mental health or substance abuse related.
Yeah. What's missing from here, or what have I missed?
Oh, institutional discrimination.
Yeah.
That's one reason.
Yeah, what does that mean? What does institutional discrimination mean?
Discrimination against like marginalized groups, racism, homophobia, anything like that.
Yeah, thanks. Any others that are showing up for you on chat that I didn't capture?
Well, this is interesting. Lack of trained professionals in rural areas. You guys will hear more about that in a moment. That came up a lot in our conversation.
Community violence. Which I think that also feeds into the trauma answer as well. Transgenerational trauma, yeah.
Poverty.
Yeah, from your perspective, what's missing here?
I think it covers a good amount. I think the support one is a big thing, definitely. I don't know if we already put that down, but having a lack of supportive adults or people to like look up to.
Lack of supportive adults. Yes. Thank you. And what do you begin to notice as we take a step back and zoom out at what is just continues to be a gorgeous tree, from these leaves, the roots, and the issue itself? What are both folks in the chat noticing, and also Isla and Lily? I'm going to leave it with you two to make some observations about this.
I'm noticing a big thing with or at least the connection I made is that mentally unhealthy teens become mentally unhealthy adults who, again, with not being mentally healthy can, with substance abuse, with violence, bad family like stuff, continue to re-traumatize and continue that cycle of being mentally unhealthy for their children or anybody else in their lives.
Yeah, it's a cycle, as we've talked about in our groups.
Yeah, I definitely agree with that. Also, I feel like looking at our roots, I can think of a lot of areas where people might experience 1, 2, or even over 3 or 4 of these roots, and that some of these might feel permanent in the moment, but through adequate resources and support, some of these can can be undone and people can find that support. But it can look very scary as a young person to be feeling one of these and then have all of these ripple effects happen and not know if that can ever be fixed. But
yeah, it feeds into some of the leaves that you all pointed out of like this feeling of hopelessness, right? Like, where do we go? How do we get out? And I saw in chat, Riley and some other folks were saying a lot of these are out of the control of an individual. As you named, Lily, sometimes it's young folks and sometimes it's adults. We miss out on the ability to control and or influence some of these things. So with that, I'm going to take a screenshot of this because I think there's so much more conversation to happen in small groups with this visual image. So I'll send it over to Isla and Lily when we break out into space. But I think we have some hope that's coming in the form of Isla's section of the presentation. So I'm going to stop sharing. I want to make sure I save this. 1 second. Saved as PNG. Look at me go. Look at me, tech wizard. And then we'll come back to Isla.
all right. Yeah, so before we break out and discuss this, I do want to leave you guys with some hope. So after lots of our research, after examining all of our research results and having conversations with our peers and people outside of the circle, we as a group came up with some recommendations for change, which I will elaborate more in a moment. But so while we were looking at our research, we noticed that many individuals mentioned feeling very alone in their struggles and not feeling as though they had anyone to turn to for help or guidance, which has been touched on a little bit. And additionally, there is evidence that a large portion of Maine youth feel that they don't have access to the support and resources that they need. So I wanted to bring that just to reiterate what is the issue. So attempting to change this is a difficult and daunting task, but through very thoughtful consideration, we have been working on a couple things in the hopes that we can move forward to a place where young people feel that they have access to the support and resources that they need. And then through our work, we have noticed 4 principal themes that I would like to bring your attention to. So first, support, which is up on the right. Support is an area where we as a group see the greatest possibility, an area for growth. We saw in a lot of our research that people feel a lack of support. And as just for someone struggling with a mental illness, support can be an extremely vital component to feeling better. So we are recommending that youth peer support become more widely available. And additionally, these youth peer support members would need accessible training to make this possible. So we have our fingers crossed and are really hoping that we can help make youth peer support more accessible. We've talked a little bit about possibly having group members certified in emergency first aid for people in mental crises, but the hope is that we can preventative measures so that we can help prevent people from feeling like they are in crisis before anything goes to that level. And then finally, our research and discussions, we found that people don't feel like they have anyone to turn to and are feeling very excluded from their communities. So we are really hoping that we can change that. Next, I want to talk about inclusion very briefly. I really want to thank you all, and we as a group want to thank you all for including this group in this webinar series, because we feel that including youth voices in these conversations is essential in working towards change. And then with inclusion, we want to also acknowledge the many people who may not have been able to make it to this meeting today due to many different reasons. We ourselves have struggled to meet regularly due to unforeseen circumstances and obstacles that we encounter in our own daily lives as well. So I did want to acknowledge people who weren't able to make it today. And also, inclusion is very important for people struggling with mental illness. Feeling included in a community which I will talk about community in a bit, but I think we have noticed the ties between inclusion and community to be very beneficial as well. But before I go there, I also want to talk about education because we feel that education is a vital element to include in this conversation today, because many resources for people who have questions about mental health are written for and designed for adults, and for little kids might not be readily available to youth. And we are hoping that we can design more resources and get more resources for youth, specifically for youth, potentially by youth. So we hope that we can contribute to that. Additionally, we recommend that education resources become open to youth looking for answers. So kind of what I was just saying, in the hopes that we can make some information available for youth who might be a little daunted by the large articles on those medical research websites. And then finally, before we leave the section, I want to mention, additionally, we feel it's important for people to look out for each other and within our communities and without. So also tying into education, if more individuals were to be aware of warning signs for people who are struggling might find that they have more support than they initially thought. So it's pretty easy to go online and find some of those warning signs of people who are withdrawing, people who are struggling in school. And if an individual person becomes more aware of those, they can have a great effect in making someone else's day better, and potentially helping them through the tough time that they're struggling with. And then, of course, better understanding of how young people experience mental health challenges, which we've already accomplished today with that last activity, looking at it through a youth lens, and then continuing to wear that lens when looking at all of these other things as well would be very beneficial. And then finally, before we break off, I want to say community has been super important. In a lot of our research, people who didn't feel that they had a community were the ones who were struggling a lot. And we feel that strong communities can be very beneficial to those within them. So within communities, if individuals were to check in with each other regularly, there might be more opportunities for discussion about mental well-being, which would also potentially be breaking stigma, which is a big task in its own. And then, as you saw earlier today, every time we meet together as a group, we check in with each other, which I can personally say makes me feel very welcome and cared for, no matter where I'm coming from, whether it's another Zoom meeting that is long and stressful, or so I have personally seen the benefits of checking in with each other and getting behind the yes, I'm fine, like asking, are you really fine? Because I know that's always my default. And then finally, creating the drop-in youth-led spaces for young people to gather. So for us, we a couple weeks ago hosted a game night, and we invited young people to come and play games with us online. It was super fun. I always find that making this, yes, it's a big issue and it's a topic that needs to be discussed, but making it seem scary and serious makes it, for me, I don't always want to approach it with that lens. So having spaces where you can be silly, like espionage, but still take away different facts and things like that. And then, of course, the informality always makes it easier to talk about these things. And especially for young kids, it can be very beneficial to be in a community and talk about these things in a way that isn't necessarily scary. So yeah, thank you so much for listening to all of our presentation. I would like to personally shout out a couple of these websites and organizations that we feel inspire us, and we are hoping to draw more from these places and incorporate more of our work with them. But I will drop in chat the links and little handles there so you don't have to take a screenshot and then try to copy and paste it. But yeah, so Yellow Tulip Project is super awesome. I've known them for a little bit. They are often in Portland, so a super great resource. Seize the Awkward is one of the newer ones that Gabe suggested. It's also super cool. Youth Move is really inspirational. And then NAMI. They have a NAMI for the general US, and then there's a specific NAMI Maine resources for people who live in Maine. So these are all super great resources if you have any questions or know anyone who's struggling that wants to learn a little bit about what options are available to them. But yeah, so these are awesome. And I will paste the links in the chat. So thank you.
Awesome. So we originally had 15 minutes planned for our breakout rooms, but because we were getting some expert knowledge dropped on us, we're going to have more like 5 minutes in those breakout spaces. So I have those all set up. So we're going to be paired. There are going to be the presenters along with another young person who agreed to show up to talk about the role of youth voice in this work. And then there will be an adult ally from Maine or an affiliated organization in that group to help with navigating questions. Isla, Lily, anything, or Lauren, anything else before I open up those spaces? Awesome, possum. We lost a few people. We've lost a few people, so we'll see what we got. Here we go. You should be getting an invite. All right. Heather, I gotta jump in to help Isla, but so I'm jumping in there.
Sure, sounds good. I can stay in this main room in case anybody comes back with questions.
Sounds great. Thank you.
Thank you.
I'm sure that was not enough time for everybody. I could see Lily is very upset with me right now for ending that conversation.
Well, I was just like in the middle of saying, somebody asked how old I was. I am 17 and going into my senior year of high school. So if that answers.
That answers my question. Sorry, it cut off.
Thank you all so much. We're past 2 and you all are still here. So thank you for staying with us after this time. Isla and Lily, any last words you want to share with the folks who are lingering?
I just want to say thank you. Thank you all for being here. Thank you all for caring.
Yeah, I want to say thank you as well. And if you have like any questions, feel free to like ask Gabe. Like, he can give you like our contact information. We can answer those for you, or like right now, if you still want to like linger a couple minutes, we can answer those. Yeah, and thank you all for being here and supporting us.
Yeah, so I dropped my email in chat. If you want to get in touch with us about our youth council work, please, please, please reach out to me. And I'm sure you want to talk to the stars of the show, not me. And we can connect with them to see if they are willing and happy to. So I'll also drop our website, Maine's website, if you want to learn more about the Maine Youth Action Network and our work. And a final big round of thank you for being here, and a big thank you to Lily and Isla. They put so much work into this project, and it's just so exciting to see it. So thank you all. Have a wonderful, wonderful rest of your day. God, I'm so happy you all were here.